So let's talk a little bit about scoring. Well, basically, when we score synovitis, we are using not all of the sequences. We actually go down to 2 sequences, and we look at the degree of synovial enhancement. And this is in the pathological group of patients. We're not talking about normals anymore. So we're looking at the degree of enhancement, the degree of blood flow into the joint and into the synovium, and also we're looking at the accompanying evidence of inflammatory change. The reason we're doing that is to give ourselves a more concrete, a more viable picture, and more abnormalities you see, the more likely they are to represent pathology as opposed to normal variation. The scoring of synovitis will be talked about by Paolo, but the degree of enhancement is going to be graded on a 3-point scale. Presence of effusion will be a yes or a no, and we're going to use 2 millimetres as a cut-off because we've looked at so many normals. Above 2 appears to be a good sign that above that is abnormality. Degree of inflammation will be assessed on a 4-point score, and again, Paolo will tell you a bit more about this. We're going to score synovitis according to different anatomical compartments, and we're going to look at the enhancement or the degree of uptake of intravenous gadolinium, the presence of effusion, and the degree of inflammation all together to give us a conglomerate picture. Scoring of tenosynovitis is slightly more complex, and Paolo will talk about that. This is more likely to be seen on the delayed post-intravenous contrast-enhanced scans. We do 2 sequences after intravenous contrast in the pathological JIA affected group, and the delayed images are the ones that we use on a 3-point scoring system. And bone erosions, as I've shown you, the normal group show little bony pits. So we are defining bone erosions, having to be present on one of the 3D sequences, and you have to observe them in at least 2 planes. If they're equivocal and we're not certain, we look at all of the other softer signs of inflammatory change, including bone edema, effusion, or a pathological enhancement. And bone erosions will be scored on a 5-point scale according to the percentage of the bone affected, and also on a degree of affectation between 0 and 10. So the papers that are going to come out of the radiology group and have already come out, we are trying very much to pool this data and to try very hard to be fair, to allocate first and last authors for each centre. So we are sharing data, we are trying to be very upfront about who publishes and from which centre, and you'll see a list of the first and last authors, and each hospital has a lead paper which they are in the process of publishing, and they are listed here. Work in progress, obviously the normals, very interesting data from the point of view of radiology. Having normative values and having an atlas of normative data is extremely important, and that will be led by the Norwegian radiologists who kindly cooperated without funding from the group. Work in progress from Gaslini. There are a couple of papers, one on synovitis and repeatability of ultrasound, and the other synovitis assessed by MRI. Published papers which have come just from Gaslini so far. These are papers either in press or submitted, and one that's already been published in 2008 with just data from the Gaslini Centre. So the radiological issues, what we'd really like to do is pool together as a large group and try to publish as a large group with all of the data together so that we're unanimous on our messages, and we're also pooling larger data sets. And I think that's the ethos of the project as from now. So in terms of where we are, looking at the wrist, we have established normal values and normal references for wrist MRIs, which is a very important and rather landmark thing to have done. Sounds very simple, but it's important. Scoring is underway, and the type of scoring we're using has been defined, and again Paolo will talk to you a little bit more about scoring in a moment. With MRIs, we've established normal references, we've constructed our scoring system, and we are also starting to look at inter- and intra-observer Kaplan Lambda scoring on this group of patients on MR. Ultrasound, the project of the scoring is completed, data has been plotted, and is in storage. Thank you very much.